Go for it.
Hello, everyone. I'm Susan Manley, and I'm one of your hosts for today's webinar, Introducing HipTrac. Let's take a quick poll. Can you all hear me clearly? If you have any audio problems or any questions throughout the seminar, you can tell us in the text box on the lower left-hand side of your screen. I'm not getting any messages back, so I want to let you know that my colleagues, Don DeBruin and Tony Rocklin, will be joining us today. We'll be recording the webinar, so we'll be able to play it back later. Today's webinar is an ongoing event as we reach out to healthcare providers such as yourself and introduce them to HipTrac. We want to hear back from you as well on how we did, and we appreciate it if you share our information on HipTrac and our webinars with your peers. Now, on the subject of our webinar today, HipTrac, it's the first medical device that delivers the same long-axis hip traction that physical therapists like yourselves and our other healthcare providers perform manually. And just like long-axis hip traction you perform, HipTrac relieves the pain and other symptoms of hip osteoarthritis. Regular use enables patients to return to their social and leisure activities and exercise more. And when they do have surgery, they'll be in better physical shape to recover faster. HipTrac was designed for independent patient use at home or in a clinical setting and cleared by the FDA for sale in 2012.
Great. Susan, can you hear me okay?
I can hear you just fine. You look good. I just wanted to ask if anybody has any athlete benefits that they would like to ask about, or if Tony can elaborate a bit on what benefits athletes get out of using HipTrac.
Yeah, that's a good point too. So my passion was around helping people with hip OA and different hip problems, intra-articular problems. But you discovered something pretty cool. So we have quite a few athletes who have some hip problems, and Mark can talk a little bit about his personal experience, being a very high-level athlete and having some hip issues if he's comfortable with that. But we have some athletes who have no hip problems at all. And a lot of those athletic trainers and physical therapists that work with these pro athletes, even younger athletes with no hip OA or FAI, they'll say part of the routine protocol is to do long axis traction and different osteopathic motions and movements and stretch people out, because they go from super intense training to super intense competition to just sitting on airplanes and buses and cars and travel. And then they got to get back up and go intensive the next day. And they notice they get a lot of tightness around their lower back and their hips and psoas. And so they do the self-psoas melt and psoas releases, and we have their trainers working on them. But one thing we notice is that when you do traction to a normal hip, there's a natural neurological, kind of neurophysiological relaxation that occurs, around QL and psoas and different muscles. And so one of those things people can do is they can use HipTrac in the training room or at home, and they travel with them, and it helps to relax and get them more prepared for that next day's intensive training. So when you want to get HipTrac for your clinic, or if you want to distribute HipTrac, there's a huge market potential for not only people that have injuries, but also elite athletes who are looking to kind of prepare themselves and do active recovery. So we're pretty excited about that as well.